This is Dr. Carl Mangum with the University of Mississippi School of Nursing. I'll be talking about treating anaphylactic shock. When we think of anaphylactic shock, we think of prevention being the key. Unfortunately, there has to be a first-time occurrence before we understand what the trigger is to be able to use the prevention to keep it from happening to the person. Prevention really is where we need to be, though, and we need to take all steps to prevent this from happening. When we think of those areas that cause the reactions, we think of three big groups. One of food, insects, and medications or meds. Now, when we think of these, with the prevention part, it's real easy. If it's a certain food, don't let them have access to the food. And it's not only eating it, sometimes just coming in contact with it, like peanut and peanut dust, can cause the reaction. Insects, if they've been stung, remove the stinger as quickly as possible and try to prevent them from being around these types of insects again. And then thirdly, medications. If they're having a reaction to a medication, stop taking that medication. Do not let them have it anymore. Now, with the exposure to the antigen and the anaphylactic shock, we have to be very careful. Fast response is critical. Now, when I say fast response, I mean not only by the person, maybe by a family member or a parent, but also by the emergency medical community, because this is a 911 event. And they need to call it because this is a medical emergency. Now, if the person already has medication that they're able to take, assist them in taking it, but still call 911 in case that medication is not effective. Now, things can get worse. They may even need CPR. They may have to be intubated to maintain their airway. And in worst case scenario, besides death, they may even end up in a hospital on a ventilator and maybe an ICU unit of some type. It can get bad. Now, let's briefly talk about medications. Three different classes of medications we want to cover today are sympathomimetic, which helps us by decreasing the vasodilatation, because it is a vasoconstrictor. Now, when we're thinking about the antihistamine, we take into account the name. The antihistamine works against the histamine, which helps decrease the capillary permeability to help with the edema. And then also we have beta-2 agonists, which help decrease the bronchospasms. Which may help the person be able to breathe better and help the swelling that's in their throat. The other thing we need to talk briefly about is what if this is their first time or the first occurrence. Okay? If that is the case, it's a medical emergency and you need 911. They need to go to an emergency department for assistance and evaluation. Now, after they've been stabilized and are okay, they may be referred to a specialist for further evaluation and or treatment. The last part we're going to talk about as far as treatment has to do with the education piece. And for nursing, this is a big area that we do a lot in. We're going to talk about three different areas. The first one is prevention. And in prevention, we want to know what the trigger is. We want to make sure that the person and the family knows what the trigger is. We want to make sure that they're able to help avoid that, if at all possible. The second area is preparedness. And in preparedness, we want to think about things like having medication, having it be within code date. Many times people find that their medication is 1, 2, 3 years out of code date and it may not be effective. Other things we want to think about are medical ID bracelets of some type, or a necklace or ID cards to help identify this particular problem. And also we want to think about CPR maybe for parents that have small children. And the third area we want to talk about is response. And in response, they got to be ready to do that CPR. They've got to have that medications with them. And one of the most important things they need to do is to remain calm. It's very important. So to quickly recap, in treating our anaphylactic shock, we want early intervention as quickly as possible. We want to stop or remove whatever's causing the reaction. And we want to give medications if available. And we want to call 911 and get them to the hospital for evaluation. And then follow up with good education to help try to prevent this from happening again.